Now it's time for today's health headlines. An exciting medical breakthrough in treating spinal injuries and a possible link between obesity and autism.
Dr. Evelyn Minaya is back on the couch to fill us in, and I'm not going to ask you to name this drug.
Yes.
But there's a new breakthrough drug in the battle against breast cancer.
Yes, and these are for metastatic. In other words, it has spread everywhere as another maybe treatment modality, which will hopefully stop the progression of the metastases. But the only problem is, does it really increase survivability? So in other words, the study said that, instead of having 10 months of progression, you actually got 20 months. In other words, for the cancer to be spreading. So we got that, at least a little bit more time in that. However, survivability, there is not really much of a difference. These patients, unfortunately, still passed, I know, and the only difference was between 33 months versus with the drug, it was 37 months of survivability.
Boy, and a lot of studies recently about the hundreds of thousands of dollars being spent for just a few months.
I know,
and you have to weigh the cost benefit.
Well, you know something, it reminds me of another drug, Avastin. Avastin was FDA approved a long time ago, didn't even go to a phase 3 because we were excited about it. Again, same exact thing, different mechanism by which it works, but then it was recalled by the FDA for that same reason, because it really did not elongate these patients' lives. And you're right, millions and millions of dollars are spent on these drugs, but is it really the quality of your life?
Yes.
And are we really elongating, just a painful journey?
Yeah.
So that,
Okay.
Well, a little hopeful, but.
Okay, hopeful, but you'll keep us posted. And
Yes.
now there's a new breakthrough in treating spinal injuries.
Oh, this was the most exciting thing I have been dying to talk about. This is actually when the spinal cord is severed or we have spinal cord injuries. This is very exciting. This is a little device that we actually put into the spinal cord, and these patients actually moved.
Whoa.
Whoa, that was the most exciting thing ever. And remember, when we have spinal cord injuries, there is no communication between the brain and the spinal cord.
Right.
And here it is, this electrical devices that are pulsated out through this little epidural device, and then these people actually moved. I was so excited.
Oh, that's unbelievable.
That is unbelievable. This is a great, great breakthrough, and kudos to the people that do this kind of research, right?
Sure.
That they have a brain and doing all these things. So hopefully on the download, hopefully it will be now brain controlled. Could you imagine?
Oh my
and get these people walking again?
This is great.
That is really great.
Now, this is interesting. A new study saying that a father's obesity could be more of a factor in the odds of a kid getting autism than a mom's obesity.
Yes, yes. And again, obesity as defined as having a body mass index of greater than 30, but even overweight men, okay, also increase that risk. I think it was a causal thing. It's like, I can't find the actual mechanism by which it would happen. What does obesity do? Is it the inflammatory response? Is it the insulin resistance? We don't really know.
Right,
It's
what
just
is that connection?
We have no idea. I know.
And
you know what? In the study, it really doesn't say what that connection is. It's just an observational study. So I think we should use caution, because what we're doing is, again, pointing fingers and labeling people.
I get the sense of that, yeah.
Right, but there are so many people looking for answers, and I think there's that hope, that that desperation.
Right.
So now, millions of women are affected by preeclampsia when they're pregnant.
Yes.
So now you're saying, well, not you're saying, but now there's word that a simple aspirin could help that problem.
Right, it is a baby aspirin to be exact.
Okay.
But you know what, this is really, we've known about this for a very long time. I remember when I was a resident, which by the way was a very long time ago, we talked about baby aspirin being given to women for the prevention of preeclampsia. Preeclampsia, by the way, is very unique to pregnancy. It's usually towards the end of pregnancy. Even young women and older women can get it. And it is with high blood pressure and proteinuria. Women can actually die from this thing. So isn't this very simple? A baby aspirin can actually prevent it. Usually it's given after the 20th week, and we stop it before the 36th week, because they don't talk about that. But that has been studied over and over again, and we think that the mechanism by which it happens has to do with the placenta, and there are some certain toxins that are created way before delivery, and that's how baby aspirin would work.
It is really just so fascinating.
I know.
And preeclampsia, one of the reasons why I had to have my emergency C-section, that was the fear. So
I know, and exactly, you can have convulsions, you can have seizures. It can also affect the baby. So people with even chronic hypertension, in other words, you have had high blood pressure before getting pregnant, we could put you on baby aspirin and maybe we'll prevent it completely.
Wow.
I know. But be cautious. Be cautious. That doesn't mean
talk
don't
to
go
your doctor.
Talk to your doctor before taking
or
any
talk
medication.
to our doctor.
Yes,
Yes, you can talk to
Evelyn Minaya.
Tweet me.
Thank you so
Facebook
much.
me, whatever.
What's your tweet? What's your Twitter?
Dr. E. Minaya.
Perfect.
And thanks for doing the color coordination.
Yes,
thing today.
Absolutely,
This is
yes.
lovely.
We did. We talked.
Yes.
We spoke this
Yes.
morning, and
Yeah.
we're glad that you could be on board. Thank you
Thank
so
you.
much, Doctor.
Thank you.